It's Dr. Alex Earl and
Dr. Vidal.
And it's Hump Day here at Pure Plastic Surgery. And today we have our very first podcast live. All right. Podcasts are the big thing. I guess people like it when people talk to each other on a table. Usually they have those things in their ears, so we're not going that fancy or crazy, but we have
yes.
Yeah. What's this?
This is our little pollito, a little chicken.
Yes, our little pollito here for our first podcast. So for the first subject here today, we're going to talk about the subject, and then we're going to get each other's perspective and whatnot, discuss it over coffee and tea. And then, of course, we'll be happy to answer all your questions, which can be related to this or really any plastic surgery topic whatsoever. All right? All right, so kick us off there, Dr. Vidal.
So I think this is the number one question we get every single live or every time. Comments is like, I have loose skin, but I also want a BBL, so I don't want to get rid of the fat. So what should I do first? So I'm going to start just by like a general description of each, and then we'll jump into which one we kind of do first and why. I guess Dr. Earl already put something there.
Yeah, put the answer on the board.
Yeah, the answer is in the board. But
no cheating.
Yeah, don't look up.
Yeah.
So basically, a tummy tuck improves the contour of the abdomen by removing the excess skin, repairing the muscle, and it also has some liposuction in the waist to get that contouring. And liposuction and or BBL is contouring, but just by removing the fat. It relies on the skin to retract to kind of see that result. So that's why it's so important when you have loose skin to determine which one is kind of the best to do first, right?
Yeah, so definitely agree with that. So really, if you really want to break down this question to like its simplest form, it's basically what is the quality of the skin, right? What's the quality of the skin that we're starting off with? So if we're starting off with great quality skin, then you probably won't need a tummy tuck. But if we're starting off with loose skin, for whatever reason, then you're going to need both. And then the question is, well, okay, what's best to do first?
Yeah.
Because there are, of course, some patients that won't need the tummy tuck at all, right? So if you're young, typically you won't need that. If you've never had children, never been pregnant, if you've never had massive fluctuations in weight, and of course genetics also plays a role. But if you have good quality, tight skin with very nice elasticity, then you won't need the tummy tuck.
Yeah. And I think that the reason, like we can jump into the reasons why one or the other doing first, but one of the main concerns that I've heard my patients say is like, but where do you get the fat then if I do the tummy tuck first? That's like basically like the concern always is if you're gonna take the fat out and tighten it, then where are you gonna take the fat after for the BBL? Right? Yeah,
and that's a myth, right?
Yeah.
I mean, I think that's one of the biggest myths out there, that there won't be any fat left after the tummy tuck. I've never had that happen to me. Have you ever had that happen?
No. I think the only patient population that I've had recommended to start with the BBL is in like very thin, massive weight loss patients that don't have a lot of fat to begin with and don't have a lot of skin laxity. That they'll benefit because the skin quality it's not great, so they have a little bit of skin laxity, but it's not like a fold that's like reaching your thighs. It's like not that excess skin. Those patients, like, let's try to get as much fat as we can and do the BBL first, and then we can do the tummy tuck. I think those are the only cases that I would switch the order there.
Yeah. But in general, we do recommend the tummy tuck first, okay? And so now we're talking about a patient that does have some skin laxity or loose skin. They may also have some weakness of the muscles of the abdominal wall or separation of the muscles, which we call diastasis. So if you have any of those things, liposuction or BBL is not going to fix it. It's just not going to fix it, right? So yeah, liposuction doesn't fix muscles, does it?
No, and the problem is that when the patient comes in with the goal of having a flat belly and on examination it's mainly the muscle weakness, you're not going to be happy with the BBL either, because BBL, in order to see the width of the hips and the projection of the buttock, it's the combination of everything. It's the contouring of the entire torso. So if your belly is not flat or it's not improved after the lipo, you're not gonna be happy with the BBL. So it's better to get that fixed first, so you can get that flat belly, and then complement it with the BBL later on.
Right. So I think they know, and it's pretty obvious that if you're gonna need both, you should definitely, we definitely recommend doing the tummy tuck first. But I guess they probably still don't know why, right? The first thing, we just mentioned, like why are people afraid of getting their tummy tucked first? And that's because of the myth that they say, well, I won't have enough fat for my leg or for my BBL. And that's definitely untrue. It has never happened to me in my entire career. I've always had enough fat after the tummy tuck. So that hasn't been a problem. But what happens if you decide you don't listen to Dr. Vidal and Dr. Roll, and you're like, you know what, screw it. I'm gonna do my BBL first. I don't care what you say. What's gonna happen then?
Yeah, but the main issue is that whenever you're doing liposuction, the cannula is going in and out in the subcutaneous space, right, between the skin and the muscle. And that area, you're thinning it down, but it needs to heal, and it forms in the healing process scar tissue and kind of attaches down to the muscle. And when you have loose skin, it's not going to attach very neat and flat. It may attach irregularly, and you can have lumps and bumps because areas that are lower kind of retract higher, and then you see those irregularities that sometimes people think it's uneven liposuction, but it's not really that. It's just loose skin. The problem with that scar tissue is like, well, just get rid of it later on. The problem is that when the skin heals like that, it's so hard to pull evenly because all of that subcutaneous tissue is already scarred down. So when you pull it, it actually may create more dimpling and more scarring. So it's better to have that tighten up in a virgin environment, not with any scar tissue from prior procedures. And then once it's tight, then you can do an even liposuction and the result is smoother and better.
Yeah, so I mean, even think about it. I know a lot of you are not, doctors or surgeons or perform liposuction, but even though if you try to place a cannula, which is basically a long wand, under something that's nice and flat and tight, well, that's very easy, right? Very easy to get things and to go and to be smooth. But if you try to do it through something that is wrinkly, think of it like a wrinkly blanket, well, that makes it very, very difficult, right? And so now things are going to heal in a way that are irregular. You're going to have your lumps and bumps. You're going to have your waviness. And then you would say, well, the tummy tuck, you'll just flatten everything out. Unfortunately, it doesn't work that way because now you have scar tissue, right? And that scar tissue sometimes can be very little and more deep, in which case you could do it. But sometimes it's not. It kind of goes from deep to all the way to superficial, and then there's nothing that you can do about that. And so when you go in to do your tummy tuck afterwards, two things happen. One is you can't pull down as much, right? Because now things are scarred down. So you're removing less skin than you would otherwise. And the other thing is that some of those irregularities remain behind. And so now the goal of the tummy tuck, which is to have a beautiful, nice, smooth belly, is not achieved.
Mm-hmm. And also, you would think, then try to release it or even it out with the tummy tuck. Well, then we end up having problems with blood supply. Because you go into that subcutaneous space and you're trying to release that, you may cut some small blood vessels because you're trying to release that scar, and when you're pulling it down, then you end up with necrosis or blood supply issues, wound openings in the lower scar, which then creates more problems.
Definitely. So doing a tummy tuck second is actually more risky to the skin. Mm-hmm. So there's a higher risk of the skin dying, basically what we call skin necrosis, or open wounds and wound issues and stuff like that. So to summarize what we said so far, tummy tuck second, why is not a good idea? All right, number one, the skin you may not end up being as smooth as you want because of the scar tissue. Number two, we're going to be able to remove less skin than we would otherwise. And number three, the skin is at higher risk for a complication. So those are already three very good reasons to, do your tummy, to not do your tummy tucks afterwards, basically.
And one of the things that I always hear of patients that want to do the BBL or lipo first is like, I don't really care about the loose skin. But what you don't really, or what you realize is that the loose skin may look worse after you deflate it, because it may look wrinkly. So the loose skin that now is the small apron on the lower abdomen that you hide easily, after liposuction, it may wrinkle up and it'll be difficult to hide, it'll be more noticeable. So that it's not as easy as it's just going to be a small apron of skin that I can hide easily in the lower abdomen. Unfortunately, it's not like that all the time.
That's right, definitely. So you still have the loose skin, but it's the way that it's loose is different.
Yeah.
Right. So if you have as Dr. Vidal said, a virgin belly, then typically the loose skin, it kind of hangs down, right? It kind of hangs, below the pubic area.
Yeah.
So it's kind of like flat above and just hanging down.
Yeah.
But once you do lipo and you introduce inflammation, potentially fibrosis, actually chances of fibrosis are higher with looser skin. You introduce all these things, well now the skin is loose, but in a different way. It's in a way where it's not just kind of flat and then hanging down, but now it looks like kind of lumpy, bumpy, and wavy, like all over the place, right? And you don't want that. And then fixing that with a tummy tuck afterwards becomes much more challenging.
Yeah. The other thing that I've seen is like fibrosis is higher because of that irregular scarring, but also seromas in the early postop period.
It gets trapped in there, right?
Yeah. So like that loose skin doesn't attach back to the muscle as a person with good skin quality and good elasticity. So that bulging is like a house or a space for fluid to accumulate, seromas. I've even seen, unfortunately, infections in those seromas because they accumulate constantly. We have to drain them, which draining a seroma multiple times increases the risk of that getting infected. So that's why if there is a lot of loose skin, I won't even recommend a BBL. It's like you have to do the tummy tuck first because it's just too risky to undergo that BBL or liposuction first.
All right, and I think we've covered most of the reasons. I mean, the other one's obvious, right? Liposuction doesn't fix the muscles, so if you have loose muscles or separated muscles, you got to fix those. And you might as well fix them first, because if you do it later, then you're going to have this liposuction done. You're still going to have that pot belly, and you're going to be like, what the hell? This doesn't look good. So you got to fix that as well. So, all right, I think we've kind of beat a dead horse here. I'm not sure that we can make it even more clear.
There's something missing. Very important.
Okay.
What's that?
It's about the timing after the tummy tuck.
Timing.
Yes.
Yes. When do you do it?
Yes,
Okay.
Doc. They are asking for that. We have like 7 questions about but how long I should wait before.
Yeah. Great question. So the soonest you could do it would be 3 months after your tummy tuck. So you do your tummy tuck first, and then you can come back 3 months or later. Of course, it can be any time after that, not sooner. But the soonest would be 3 months, and you can do your lipo 360 and BBL, and that's when you're going to have an overall outstanding result. Because now you're going to have everything that you were looking for, right? You were looking for that beautiful flat belly, and so now it's going to be flat, because you did your tummy tuck. So that means you repaired the muscles, you fixed the diastasis. You got rid of all the loose skin, so now you're going to have a nice flat belly, and of course everything else that comes with the contouring of the BBL.
But the opposite is not true. So if you do liposuction first, that scarring and that scar tissue has to soften up with time. There's more like scar tissue after liposuction than actually after a tummy tuck. So we have to wait longer, maybe 9 months to a year, for that to soften up to then come back and do a tummy tuck.
Yeah, especially that belly skin is looking like it has a lot of inflammation or fibrosis, and you gotta wait longer, and also taking into consideration the blood supply issues to that skin. Yeah. What else? I think overall, questions.
Yes.
Yes.
Yes, this is on fire.
Stop talking.
Yeah.
Answer the question. All right, let's do it.
Yes, Doc. First question. I'm thinking about this is on YouTube, and YouTube's on fire today.
Oh,
Yes.
YouTube. A fuego.
A fuego. They say, thinking about a medial thigh lift with lipo.
Okay.
What's the recovery like? How long do I wait after my tummy tuck? It's been 6 months.
Okay, so
Alright.
yeah, definitely you're good after 6 months to undergo a thigh lift. I would say a minimum of 3 months after your tummy tuck. Afterwards, your inflammation and recovery of the tummy tuck is almost complete. You still may have some inflammation, but you're good to undergo a thigh lift at that point. The thigh lift and a combination of thigh lift with liposuction can be done. I do it often, and it depends on where is the skin laxity and where we can hide that incision. So there are basically 2 main types of thigh lifts. One is what we call a crescent thigh lift, where incision is hidden in the groin. That great candidate for that is a patient that has that excess skin in the upper inner thigh, not extending towards the knee. You may have some fat extending towards the knee, but not skin laxity. So it's not like a bulging up in the knee. If you have a bulge that extends up to the knee, then it's more of an extended thigh lift, which has that crescent incision hidden in the groin, but also a longitudinal scar that goes from the groin down to the knee in the center or in the medial aspect of the leg. When I do a crescent thigh lift, I usually combine it with liposuction, and that it gets a better contouring of the inner thigh and kind of pulling that excess skin towards the groin to hide that incision there.
All right.
Okay, let's keep going with this. Mini tummy tuck scar. Do you move the belly button much?
So if you're doing a mini tummy tuck, you don't move the belly buttons. Okay, the official term for that is called umbilical transposition or movement of the belly button. And that's actually part of what makes a mini tummy tuck a mini, is the fact that you're not moving the belly button and you're not doing that plication. So if you have separated muscles or weak muscles, you're not a candidate for a mini tummy tuck. You need the full tummy tuck. It's not very many candidates for a mini tummy tuck. It's really like that specific patient where the muscles are pretty tight, they're not separated, and they just have a little bit of that loose skin underneath the belly button.
Very commonly after a C-section, and the belly kind of flattens very well, but the C-section scar kind of tethers the skin and you have a little pouch of skin. That's basically like the best candidate for a mini tummy tuck. And the mini tummy tuck is not really a mini scar, because the length of the scar will depend on how long is that fold of skin. It's more because it doesn't include the belly button and the muscle repair.
Yeah, it's gonna be longer than your C-section scar, for sure.
Okay. Do you abdominal etching during liposuction?
Yeah, so we can certainly do that for the right candidate, right? Not everyone's a candidate for that procedure. So who is a candidate? Well, it's usually someone that's a little bit lower on the BMI scale, and someone that has good quality skin. Once again, we're back to that subject. So here's the thing. What you say, you start off with not good quality skin. Can you then become a candidate? Well, yes, if you do your tummy tuck first, right? So deal with the skin issue, tighten everything up, and then you can, if you come back, you can become a candidate for abdominal etching or HD lipo once the skin issue has been taken care of.
Yeah.
Okay, I did paniculectomy. Can I get lipo 360 and a BBL?
Yes, definitely. A paniculectomy has the similarity to a tummy tuck with the resection of the skin, but in the paniculectomy, usually we don't do a muscle repair or liposuction. So if you don't have that loose skin because you did the paniculectomy already, then we can definitely do a lipo 360 on that case.
Yeah.
Okay, thoughts on cell saver? Does it really help avoid major blood loss?
Well, it doesn't avoid the blood loss, right? It helps you deal with it if it happens. Let me explain that. So, what is the cell saver? So the cell saver is a machine that we use where we pass the fluid that has blood. We pass it through the machine so it can separate the blood from everything else, and we can then give the blood back to you, right? So when we're doing liposuction, the first step is we instill a whole bunch of fluid called tumescent fluid. And then we do the lipo, and so out comes fluid, out comes fat, and out comes blood, right? And that all gets into a large canister, which is sterile. Now, then it starts to separate out. Who knows what goes on top? Is the fat on the top or the blood on the top? The bloody fluid on the top? Who knows?
Waiting for some answers here.
Any answers here? Come on, guys! I've taught you this multiple times throughout the years.
Now they are listening. That there's a short delay. It's not like
Okay, all right.
okay.
All right, so you have your canister.
Okay. First
You
answer.
got a separation
Fluid.
on top.
Fluid on top.
Yes. So the fat goes on top, okay? And then on the bottom is bloody fluid. So what we do then is we put a cannula down into here so we can remove the bloody fluid. And then we keep the fat, of course, for your fat transfer. But then that bloody fluid, we don't just toss it. We run it through your cell saver machine. And so the cell saver machine has multiple filters. I believe it has like 4 filters in total. So 4 filters, and with the filters, it's able to actually remove the blood from everything else. So basically it isolates your own blood. And then, we put that blood goes into a bag, and then we give it back to you in an IV. So that way, yes, overall you have less blood loss for the case because we're giving some of it back to you. So there's less blood loss, and therefore you feel better, you recover better. And that's why we do this for all our big liposuction cases. So lipo 360 and BBL.
Okay, let's get with another question. Is an open gallbladder removal scar a no for you for tummy tuck? I've been told no twice.
What was it?
Open cholecystectomy. So with an So an open cholecystectomy scar basically can go up to the midline. So if it's a small one, maybe, but if it goes all the way to the midline, it cuts the blood supply that goes to the skin that we're pulling down and has a higher risk of having wound healing problems, skin necrosis. So that's why I've told you before that you're not a candidate. There's a different type or a different version of a tummy tuck that basically, instead of doing the muscle repair in the center, the reason is when we're doing the muscle repair in the center, we have to elevate all the skin from the muscle in order to do that. And when we pull the skin down and when we're elevating that skin from the muscle, we're cutting some of the blood supply, and it comes from where the scar is usually. In your case, because of that scar there, then we would do another version of muscle repair, which is a transverse abdominal plication. That way we repair the muscles, flatten it, but without the need to elevate the skin. The main difference is that we can't use your belly button, and we have to do what's called a neo-umbilicus or a new belly button. A new belly button, which may heal with time a little bit differently, but usually heals pretty well with the technique that we use. And at first it may look a little flat because of the inflammation, but after the inflammation goes down, it tends to create a very natural looking belly button.
Yes, that's called the Tolua tummy tuck or Tolua abdominoplasty. Again, not everyone's a candidate. We would have to evaluate your specific case, but potentially there is an option for you. You can't have too much muscle separation though, right? If your muscles are like very separated or very weak, then unfortunately it doesn't work. So, but for the right candidate, it works well. Yeah.
Okay, we have another here. How long after a BBL can you sit without a donut? BBL pillow.
With a
Without
BBL
donut or BBL pillow.
Yes, so we recommend at least 6 weeks, okay? The reason for it is the fat that we transferred. Basically, it's like you're putting a little plant in a new pot or a new area, and it needs to kind of build its own roots there. So those roots are still not very well developed. So if you don't put the right resources, which is no pressure and good hydration and good nutrition, the roots are not gonna kind of develop and the fat dies. So the pressure, that kind of process takes about 6 weeks to happen. So that's why no pressure, good diet, good hydration for those 6 weeks to get good roots and the fat lives.
So that's a nice analogy. I had to use the whole roots thing. But sometimes we get the follow-up question. They're like, well, how come? And this used to be a little bit more before too. But how come in Dominican Republic or Mexico they tell people they can sit right away?
Yeah. So majority of times when they tell you to sit right away is because they're putting it in an area that has a lot of water and nutrients, which is the muscle.
Yeah.
And that area, it's no good because it has the risk of fat embolism. We're putting it in an area or in a terrain that it's not as fertile than the muscle,
Yes.
but it's more safe. So it's a lot better to put it there and
Right.
with the right conditions, it'll give the roots.
Yes, that's right. So why do they do it in certain places? That's because they're putting fat in the muscle, which we know is dangerous and could lead to fat embolism and death. Definitely not a risk worth taking. I think you want to be safe. You want to put it in a safe space and just not sit for 6 weeks.
Okay, docs, we're ready. Explain how to get a consultation before we go home. Yes, it's important because many people want to know about, yes, doc, whoa, 28, but you have to explain how to get the consultation.
How to get the consultation.
Yeah.
All right. So Dr. Vidal here, she's putting the website up, which is pureplasticsurgery.com. And yeah, you go to pureplasticsurgery.com, you're going to see like a button there that says virtual consultation. So you're going to hit that, and that's going to take you directly to our questionnaire and where you can upload some photos, okay? So you fill out all the questions, you upload at least 3 photos. If it's a BBL, at least 4, because we need the front, the 2 sides, and the back. And then that goes to our patient care coordinators, okay? They are super knowledgeable, super nice, super friendly, and then they'll give you a call, and they'll take it from there. Now, a couple of questions or glitches we always get with this, okay? One of them is like, hey doc, I did this, and it wouldn't let me put more than 1 procedure. That's okay. Don't worry about it. Put the one procedure that you care about the most, right? And then when the patient care coordinator calls you, she'll be able to figure out the rest of it. So you can add another procedure, or she can tell you whether it's a good idea or not, or whatnot.
The other one is, I want to come in person.
Yes.
I always ask about that. So you can still, you just fill in this out. The patient care coordinator gives you a call, and then we can schedule either a Zoom or it's not Zoom, but a telehealth visit with one of us. and or if you're here in Miami and you want to come in person, you can as well.
Yeah, so those options are always there. Don't think that just because we're sending you here that is the only option. It's just the easiest, fastest, most efficient way to get started and get a hold of our patient care coordinator, who will then basically do whatever you need. So from there you can get a video consult, you can get an in-person consult, you can go over options. Basically they'll help you with anything you need for your entire journey, from the surgery to post-op care, to places to stay, to nursing, everything. Okay? All right, everybody. Well, I hope you like the format here. Yes, our first kind of podcast-like format. Hopefully you could hear us through the pollito here.
Yeah, with the mascot. A little mascot here.
And I look forward to seeing you all next week on Hump Day with Dr. Alex Earl. All right.
And you?
Take
and
care.
Tuesday tips.
Yes,
on
don't
Tuesdays.
forget Tuesday tips.
Yeah,
All right.
see you guys.
Take care.
Bye.
Ciao.